What's the nature of your emergency?
Good morning, police, fire, military, and families, and to everybody who is listening in on the Tactical Living podcast. I'm your host, Ashley Walton. I'm going to start out by just saying what our giveaway is because I always feel like I forget what we're giving away. So today I'm going to give away an ammo box, a paracord bracelet with a USA emblem on it, and then a pack of dude wipes to whoever comments the most within 24 hours. So in saying that, remember that this is a safe space, and that is especially applicable to today's guest. So if you guys have any questions, feel free to drop them down below. Today's guest is somebody that I'm excited to interview because it seems from all of the content that he's put out and some research that I've done, good morning, on his work and his website and things like that, he very much understands the difference between modern medicine and allopathic medicine. From my 14 years of experience working in medicine, I can tell you that that is a rarity. So I would like to welcome Dr. Tracy Gapin to our show. Doctor, how are you?
Thanks so much. Good morning. Glad to be with you.
We are so lucky to have you. Good morning, everybody. You need another ammo box. Well, I'll drop your questions. And then if for some reason we don't get to them here, then I will make sure that we get to them via email or however else we need to. Now, I listened to your incredible TEDx talk, and I just want to preface this by saying that even if somebody is listening to this and they don't have balls to protect, tell us why this is a show that is for both men and women.
Oh, thanks so much. Yeah, women make most healthcare decisions. So make no mistake about it. Men, we have this if it ain't broke, don't fix it sort of mentality. And so what I find is most men who actually take care of their health and are proactive, there's a woman behind them kind of pushing them and nudging them along. And so while everything we talk about may apply to men and women, a lot of the men's health stuff we talk about, we emphasize the focus on women because women are the one that are going to often be the ones to get men to take action.
Thank you for sharing that. When I was doing my research, doctor, one thing I couldn't answer the question to is what got you into medicine in the first place?
Great question. When I was in fourth grade, we had to, in our science class, whatever, in our homeroom, we had a diagram of the heart mapped out on the ground in tape. And you had to walk through the four chambers of the heart as we're learning about blood, circulatory system and the blood flow. And I suddenly became fascinated with the human body, with anatomy. And my mom was a nurse, and so that was probably a big factor there as well. But I knew in fourth grade that I was going to be a doctor. And from then on, I never really wavered. I knew I was going to be a doctor. And for me, men's health has a personal emphasis or focus as well, with a crummy childhood that I had. And so it was a natural transition for me when I knew I wanted to be a surgeon. And I had to focus on men's health, that urology became the obvious path for me moving forward.
Now, I know you have a story. Good morning. I know you have a story to share that took you from that focus being strictly on urology and surgery and things like that into something a little bit more focused and streamlined. So can you share that with our audience?
Sure. Yeah. So, like a lot of the men who are listening, I was very focused on my career. I was driven. I was grinding, working hard. As a urologist, I had a busy practice doing robotic surgery every day, treating prostate cancer, treating kidney stones, and really neglected my own health. And, woke up one day and suddenly realized that I'm 30 pounds overweight. I am stressed out. I'm not sleeping. I'm eating like crap. I'm not exercising, and I'm a mess. And here I am as this, men's health expert in air quotes. And I was really doing a disservice to myself, to my family, to my patients. And so I went to have my first physical exam ever. And doctors are notorious for being bad patients. And so I'm 40 years old going with my first exam ever. And it was a mess. It was a disaster. My labs were pretty bad. And it was a very vulnerable experience to suddenly become face-to-face with your own mortality and to realize that I'm not bulletproof and that I needed help. What was really disappointing, though, was that this primary care doctor, this concierge doctor here in Sarasota, Florida, had no great answers for me. He basically just told me to eat more vegetables, lose weight, exercise. If I don't get better, I'll need to be on a statin. And I know there's a lot more to it than that. Yes, I need to exercise. Yes, I need to eat better, get in shape. But he really didn't have any real crystal clear, specific answers for me. And so I started researching and studying and going down one rabbit hole after another. And I learned about, it started with epigenetics, which is the science of how your lifestyle, behavior, environment affects your body, physiology, and genetic expression. That got me into functional medicine. That got me into peptide therapy and hormone optimization and longevity. And before I knew it, I had so many new certifications and courses and credentials and more importantly, education that I can apply on myself that was completely removed from my traditional background in surgery and urology. And so armed with all of this new information, I was able to really turn things around, where I was able to burn fat, build muscle, regain my energy, my focus. I felt like a man again. And I suddenly realized how broken our healthcare system is, that I was able to do all of that only through my own research and study and really thinking outside the box. So I started applying this with my patients in my urology practice as well. And they started seeing great results. And I really suddenly, Ashley, found my passion again. I found my love for medicine that I had honestly lost for many years. Our healthcare system is a mess. It is broken. It is focused on disease, illness, symptoms. It's all about finding your ICD-10 diagnosis code and treating it with a drug. So it's diagnosis, drug, and so on. And I have really found my passion in this space of health optimization, which is how can I get you to an optimized state, not just treat disease, not just treat illness, but actually help your mind and body function at the highest level. And to do that, we have to go outside the box and think beyond what our healthcare system is based on.
One of my mottos in life is to never take advice from somebody who hasn't done it before. So it truly is amen. You're right. It is a breath of fresh air to be able to hear somebody who is practicing what he preaches. I have to go into selfish Ashley mode because I want to ask, what took you from being that man who just gives himself excuse after excuse about the ailments that he might be experiencing to finally going and getting that physical for yourself for the first time?
Yeah, great question. It was sudden awareness of my own mortality. I, at that point, was about to have a child, our first child. And for me, being the best father, the most present and engaged father that I can be is my why. That's my big purpose in life. And to do that, it's kind of like the concept of putting your oxygen mask on before you help those around you on the airplane.
Mm-hmm.
I talk about I have to take care of myself before I can help others around me. And so to be the best husband, to be the best father, to be the best leader that I can be, there are a lot of things that I have to do that traditional healthcare just isn't there for, can't help me with. And so that's really what it's all about. And selfishly, it was about my own health in the beginning, but now it's for me a passion to create a movement around transforming men's health and to get men to think very differently about their health. Quit waiting for a problem to occur. Quit waiting for your doctor to tell you to do something. Get the advanced testing that you need done to find what I call the hidden blind spots that are either holding you back or lurking under the surface. And then quit taking this one size fits all mentality when it comes to health. And I like to say one size fails all, where you need to understand what's right for you. And that comes through testing and observation. And, it's N of one medicine, which means each and every one of us is our own little clinical research trial. Try something and then use data to determine if it worked or not. Track, with wearables, you can track sleep, you can track stress levels, you can track blood sugar, you can track body composition, all these things that you can track so that you can assess if what you're doing is working or not. And so it's all about taking a very fresh, unique, different approach to men's health than what we've been taught.
Yeah, I want to put this caveat and disclaimer out before we get into what we're about to talk. One size fails all. Yeah, I know. I love that too. Before we get into what we're about to talk about, because I know that you are very clear on there being a purpose for patients in traditional medical settings to seek out traditional medical treatment. An example I heard you say was, if a patient has a heart attack, for example. So after this evolution of gaining the knowledge and just this self journey that you went on yourself, what are some of the differences that you've seen in practicing medicine this way versus somebody who, I believe the stats you said was like medicine is 17 years behind with the way that physicians are practicing now? What are some of the differences that you've seen?
Yeah, so that study that was published actually showed that most doctors, the 17-year stat is that it takes 17 years before doctors will embrace new science. So scientific publication will come out, research will show something. It'll take them 17 years before they actually open their mind to adopt this new thinking. And so that's really the basis behind it all. I'll give you an example. You go to your doctor, you get labs drawn, and testosterone is where men's health seems to always kind of steer. So we'll go there for a moment. You'll get your labs done and the doc will do total testosterone, let alone the fact that that's the wrong lab. You should be getting a free testosterone. But nonetheless, they'll get the lab and they'll look at the right side of the page. And if you ever looked at your labs, you'll look at the right side of the page, you'll see a range on the right. And for testosterone, it's this ridiculous range, like 240 to 950 or something ridiculously wide. They will then tell you if you're in that range that you're, quote, normal. Your labs are normal, you're fine. And to me, that highlights what's wrong with our traditional healthcare system. There's no normal. It's what's optimal. What do I need to function at my best level? We know from several studies, 3 massive 20 to 30-year trials here in the US, Sweden, and Finland, all 3 studies show the same thing. And that is that testosterone levels worldwide are plummeting. Free testosterone, which is the bioavailable active form of T that we care about, is anywhere from 35 to 45% lower than it was 20, 30 years ago. So let that soak in for a second. A 50-year-old guy today has a free T level that's almost half what a 50-year-old guy had 20 years ago. And it continues to drop every year. So that range that you're looking at on the lab slip, that reference range, is nothing more than the average that LabCorp Quest may see in the billions of labs that they're doing. So every year, that range will get lower and lower and lower and lower. And you're being told, well, you're normal because you're in this ridiculous moving target. And so to me, that's the biggest example of how flawed our healthcare system is, that we're so focused on just making you, quote, normal. And that range keeps moving so that, of course, you're going to fall in that, quote, normal range because it keeps dropping lower and lower.
Yeah, when I worked at the hospital for a few years, every provider I worked around was burnt out with a system now. Yeah, and the problem with that, I think, and the experience I've had is that not all doctors are like this one. Most doctors don't want to take the required effort to be able to further themselves educationally, apart from the CMEs that they need every single year. So that's a really, really great point. And I know that you call this like a silent epidemic in not just our country, because this is worldwide. Why do you think this is happening?
Number one answer, toxins. So, you could look at nutrition, you can look at our stress levels, you could look at, poor sleep, you can look at all these other factors, lack of activity and a sedentary lifestyle. But there are dozens of studies that show the effect that toxins in our environment are having on our hormones, our endocrine system. And these are referred to as endocrine disruptors. And there are studies that show that things like phthalates, which are used to make plastic, BPA used to make plastic, atrazine, it's an herbicide that's sprayed in our crops. Parabens, which are chemicals that can be used for plastics, they can be used for scent, they could be used in all kinds of artificial products. Studies have shown that all of these chemicals are crushing our hormone function, specifically testosterone. They're causing infertility, they're causing autoimmune disease, they're causing immune dysfunction, they're causing obesity, causing mood disorders, depression, anxiety. And studies have clearly shown that things like, for example, there was one study, pretty crazy. They found that they would take male frogs and they'd expose them to very low levels of atrazine, exponentially lower than what we're exposed to in the foods that we're eating. And they made male frogs turn into female frogs that can actually lay eggs and reproduce. So think about that. A male frog turned into a female by simple exposure to atrazine, and we're eating that every day in our food supply. There was a study that looked at chemicals in our water, and it's very clear that we have synthetic birth control at very high levels in our water supply, in our drinking water. Now, this is the birth control that women use, obviously, for birth control that is not filtered well through our water treatment systems, and we're drinking it, and we're absorbing it, and it gets into our bodies, and it gets stuck into our fat, and it stays there, and it crushes hormone production. It turns testosterone to estrogen, and it has a long-term estrogenic effect. So I know I'm speaking all doom and gloom here, and it's getting worse, but what can we do? It starts with really mitigation. It starts with being sure that you're eating clean foods, that you're insisting on organic, especially when it comes to, fruits and vegetables, that you're eating grass-fed organic meats, that you're eating wild-caught fish, so that you're avoiding these chemicals. Plastics, one of the biggest sources of chemicals is plastic. So I would insist that no one drink from a plastic water bottle. You should be always using, a stainless steel water container. I filter my water. I have a home system that we had installed to filter our drinking water and our ice, because your water is full of chemicals, and that's the biggest source of it. So it's the food you're eating, it's the water you're drinking. Make sure that you're not storing any of your food in plastic containers, especially if you're going to heat it up. Personal care products. There are apps on your phone that you can use to look at the things that you're putting in your body. Laundry detergent, soap, deodorant, sunscreen, shaving cream, stuff like this that your body absorbs, and these chemicals are crushing our hormones. And so you can get an app on your phone. The Environmental Working Group has one called Healthy Living. It's a little green icon, Healthy Living. It's free. If you like free, download Healthy Living. There's also one called Yucca, Y-U-K-A. They both do the same thing. What they'll do is they'll enable you to scan a barcode of any product at the grocery store or drugstore, and it'll tell you the ingredients in that product. And you'll see all the crazy chemicals that you didn't even realize you're exposing yourself to. And so it starts with mitigation. Every little baby step you make every single day makes such a big difference.
Yeah, that Yucca app I was just sharing with my husband. It's cool too, because it also tells you what this chemical is, and also if it's what it does to you, like an endocrine disruptor, for example. So it's fast food, the reason that my T levels are so slammed at 53.
So when we talk about the testosterone epidemic, I'll tell you, nearly every guy I see off the street, they tell me, yeah, I feel fine. I could be a little better, but I'm fine. And I check their levels and they're massively diminished. And so does fast food contribute to that? Well, sure. Anything that's causing inflammation, that's driving cortisol, can certainly crush testosterone. It's not just toxins. It's poor sleep. It's poor nutrition, it's inflammation, it's poor blood sugar regulation. Insulin resistance is a medical term for when you don't regulate your blood sugar well. High stress levels, poor fitness level, lack of regular exercise. All of these things can contribute to low testosterone for sure.
Thank you for sharing that. Cost-free, 90-free. Yeah, I know. So Healthy Living was the name, and then Yucca, Y-U-K-A, for those apps. I would recommend downloading both, because sometimes one product might not be found on one of the apps that might be found on the other one. Now, typically when we hear something like hormone therapy, one might think about a female in menopause. Talk to us about why that's not true.
Yeah, so most men who have low testosterone, the first question is, well, how can I raise it, obviously? And there are natural ways you can do it, and there are not natural ways. Natural ways, things like, high weight resistance training, especially training the quads, your hams, your back, your core, your abs, big belly muscles can raise testosterone. Improving your sleep quality, reducing stress. These are all natural ways that you can improve testosterone levels. Even studies have shown by sunlight to the scrotum can improve testosterone levels. Kind of crazy finding. But all of those will not tend to move the needle enough to get you where you need to be. So for example, most guys come in, their free testosterone level will check, and it's 5, 6, 7, 8 in that kind of ballpark range is what I see very commonly. You want your free T to be 20 picograms per milliliter is really your target. And if you do those natural approaches, you may get up to 12, 11, 10, somewhere in that kind of ballpark. Again, you're not even close to where you want to be. So that gets us to hormone therapies. Your question is, does this apply to men? Absolutely. When men get on hormone therapy, when we replace testosterone, we can get that level all the way up to where it needs to be. Now, I want to clarify, we're not trying to make bodybuilders here. We're not trying to make supermen. We're trying to make men. And so I'm very clear that, while we're trying to get your free T up to around 20, 25, bodybuilders may have a free T of like 200. So I want to be clear that there's like an exponentially different scale we're talking about. And so a lot of the negative consequences or side effects you hear about with T is when you're at such an anabolic state like that. It's a very different night and day story. When we get your free T from 3, 5, 7 up to 20, what happens is this. You suddenly have more cognitive function, your focus, your mental acuity, your memory, your mood, your energy, your drive, your feeling like a man returns. You're able to stay awake throughout the day. Your energy is there so that you want to actually go train. You want to lift weights. Your energy is there so you want to actually have sex. So you're able to perform at night. You're able to burn fat. You're able to build muscle, increases your metabolism. It improves lipid numbers. Very important here. Improves lipid numbers, improves blood sugar numbers. And most importantly, studies have shown without question that when you optimize that testosterone, like we're talking about, the risk of a cardiac event, the risk of major adverse cardiac events goes down by the order of 30%. Let me repeat that for the listener, because that's a bold statement, but it's true. Over a dozen studies have shown that when you take men in the lowest quartile of testosterone levels compared to the highest quartile of testosterone levels, 30% difference in cardiovascular events. And so by optimizing testosterone, we know that we're improving lipids, we're improving blood sugar numbers, we're improving inflammation, and we're improving cardiovascular risk, not to mention all the qualitative, side effects that you get when it comes to quality of life.
Yeah, for sure. I get the shots, laugh out loud. Mine was down to 3. No more Del Taco, I guess. Yeah. And I think the truth here is that everything needs to be in moderation, and be something that is sustainable, right? And I know we only have about 5 minutes here. There's a lot of questions that I have, but I'll try to limit it down to 2. The first one is when a lot of people that I have talked to, because we've had other guests on the show that have shared a similar conversation, not as in depth as you have. So I thank you for that. But one of the pushbacks is that if a patient starts to take the injections, for example, that it's something that they're going to have to do for the rest of their life.
Oh, yeah. I love that question. Yeah. So I get every time I'll get that question. So does that mean I have to take it for the rest of my life? So what happens is when a guy gets on testosterone after having a lengthy discussion about pros and cons, and with our very few cons, what happens is, again, energy improves, sense of vitality, drive, cognitive function, metabolism, ability to burn fat, build muscle, sleep better. All these things get better. That conversation very quickly turns to, Doc, you're not going to make me stop this ever, are you? Mm-hmm. It pivots very quickly. The answer is because of the reasons we discussed previously, because of the endocrine disruptors in our environment. And actually, the reality is those chemicals and toxins affected our grandparents, affected our parents, and it's going to continue to have a generational effect as well. And so a lot of the damage has actually been done before you were even born. And so the answer is your body's not making enough testosterone, and there's no natural way that you can get it back to where it needs to be because of all these issues that we've talked about. And so one way or another, you need to get your testosterone to where it needs to be. And so it's not a question of, do I have to take it for the rest of my life? It's you get to take it for the rest of your life. And once you start it, I honestly, in my 26 years of practice now, I have not ever had a guy that has asked me, can I stop it now? Guys don't want to stop it because it has such a massive impact on their quality of life, as well as, metrics when it comes to their health as well. And so that's my answer is that, guys, once they start it, yes, you have to stay on it for life because you need testosterone for life. And one way or the other, we got to get those levels where they need to be.
They give me that shot mixed with a B vitamin shot. Please ask him if it is B vitamin that helps.
So B12 shots for people who have low B12 are great. Some people need, and this is where one size fits all, a very individualized approach. I will never say everybody should take this, everybody should take that. What I would recommend is you test, you find out where your deficiencies are, and you address them. And then you assess and you reassess to see if what you're doing is working or not. And so do some people need B12? Yes. Do others not need B12? Absolutely. And so I want to be really clear that there's no magic answer that's going to treat everybody.
Yeah, great answer. Now, for a patient who might have listened to this episode and they're wanting to know if they're a right fit or not, what would be the ideal client, the ideal patient of yours that would meet the criteria?
So when I work with men, they're driven, they're motivated, they recognize that there's a lot they need to do to be better. And the key word I emphasize there is better. Because a lot of men will say, yeah, I'm fine. I'm okay. My energy's not bad. I could lose a few pounds, but no big deal kind of thing. Most guys feel like that, but then there are so many hidden blind spots, again, that I call them, that are issues under the surface that can be improved if you want to be, at your optimal level, if you want to have that optimized state where your mind and body are functioning as best as possible. And so it's the guy who is driven to understand how can I be the best husband? How can I be the best father? How can I be the best leader that I can be by creating continued momentum to get better every day? And so that's a unique individual. A lot of guys don't have the motivation, the drive to do anything, and they'll wait until there's a problem. And that's unfortunate. You're stuck in the traditional healthcare matrix where if it ain't broke, don't fix it. But that's going to catch up with you very quickly.
It was funny listening to one of your interviews because you had said it's the same reason why men don't ask for directions.
That's right.
Your website is thegapininstitute.com. I know that you're located in Florida. So what if somebody's listening to this and they are not located in Florida?
Yeah, we do telehealth in every state in the country. So we do probably 60% of our clients are actually from out of state. So not a problem. So I could not do what we do here on my own. I have a great medical team. I have a team of coaches. So functional medicine coaches are really integral to what we do. As great as the hormones and the peptides that we prescribe may be, as great as the diagnostic testing is that we do, a lot of it is the work that you need to do yourself at home. And so our coaches work with our clients to really help provide accountability, support, guidance. What do I do? How do I interpret this wearable data? This says my sleep data was only 13 minutes last night. I should get an hour of deep sleep. What's wrong? What do I do? It's that kind of stuff that just takes one-on-one support. Guys don't want or need more information. There's information overload out there on the internet and podcasts, and everywhere you go, there's more information. Guys need clear guidance. And it's funny, Ashley, I heard this for over 25 years. Guys say, just tell me what to do. And guys need very clear direction, guidance on what do I do? And so that's what we do.
Thank you. Just for the sake of full transparency, we have a question down in the comments, but we'll do mine real quick so I don't forget it. If a patient they have their appointment to do telehealth with you, I can understand that you can order labs and things like that, regardless of what state they live in. If the discussion is had to order some type of hormonal therapy, how is that delivered? So who do they go see?
Yeah, it gets shipped to your door. So when we work with clients remotely, and we're licensed in multiple states, and we have solutions for people who may not be in those particular states. But when we work with clients and we prescribe testosterone, other hormones, peptides, supplements, whatever it may be, it all gets shipped directly to your door.
Perfect. California and insurance, I'll call them. So I think the question is, where does insurance play into this?
So California, yes, we're actually licensed in California. We do not use insurance at all. Again, insurance is based on disease model world of find a diagnosis and they'll treat, they'll cover the management of that quote diagnosis. We don't work on diagnosis codes. We work on optimization. And so we do not work with insurance.
Perfect. Thank you.
I should say insurance that won't work with us. Let's put it that way.
Not yet anyways.
That's
I think
right.
we're coming
Eventually
around.
We hope they will. That's right.
I've been talking to some people in the UK, and it seems like the UK is so much more advanced when it comes to linking the exact conversations that we're having with patient needs and what insurance does and does not cover. So I think that's coming. Yep. Doctor, thank you so much for answering all of our questions, for spending time with us this morning. If everybody wants to write down the Gapininstitute.com, you can go ahead and reach out to Dr. Gapin's staff or to answer any questions that you might have. If you have any more, you can drop them down below, and I will talk to you guys next time. Thank you.
911, what's the nature of your emergency?